Hey everybody, how are you? Welcome to this week's successful patient story. I'm going to be sharing a story of a patient who has mild sleep apnea who did really well with some very interesting conservative measures, and we were able to objectively show that she's done phenomenally well. So this lady, she's 38, history of sleep apnea, has some mitral valve regurgitation, anxiety, depression, OCD. She came to us just a month and a half ago for a sleep apnea evaluation. And in terms of her sleep apnea, she was diagnosed with sleep apnea in 2010 because of symptoms of excessive daytime sleepiness. Had an in-lab study, was found to have mild sleep apnea. Not much was done about it at that point in time. Eventually went the path of sleep apnea dentistry, had a dental appliance. Because there was some bite changes that happened and then difficulty with eating because of those bite changes. She tried CPAP for 6 months, was unsuccessful, had some intolerance, and noted that she wasn't feeling significantly better. And eventually went the path of a MMA, a mandibular maxillary advancement surgery, which is a very morbid surgical procedure. Had it done by one of the best surgeons in the country, where the mandible and the maxilla are broken and brought forward to change the anatomy of the face and airway. And overall, she's doing well. She was curious she started noticing that she was feeling more, sleep apnea progresses with age. So started noticing that snoring was coming back. She was doing myofunctional therapy and came to us for an evaluation. So let me go ahead and share with you what's going on in terms of her sleep. So this is the patient dashboard, and she did about maybe 7 to 10 days of testing in the beginning, and you can see that without any intervention, sleep apnea indices are mild, but because she had symptoms of this sort of afternoon dip and not feeling so rested, and snoring was coming back. All of these nights, this data fit the picture of mild sleep apnea. The quality of sleep was somewhere between good and excellent, but she was symptomatic during the day. Given that she had already tried dental appliances, we didn't want to go that path. She's already tried CPAP. We felt that it would be too much of an intervention. She's gonna do myofunctional therapy. But we also wanted to add what's called Bongo. You may be familiar with this. Bongo is it stands for EPAP, End Expiratory Positive Airway Pressure Device. And basically the way this works is that you put this device in your nose, you sleep with it. It's approved for mild sleep apnea. It can be used for more too, as an off-label device. You put it through your nose, you breathe in, and when you exhale, there is some level of resistance, and that level of resistance causes the upper airway to expand during sleep. So it's almost like exhaling against some kind of pressure, and when you exhale against that minimal pressure, that creates enough positive airway pressure to keep the airway open. So we tried this. And it took the patient a couple of days to get used to it, but what you can see here is as she got used to it, and we also combined lip taping to this to help keep the mouth closed. And you can see that the apnea indices went from like the 5 to 8 range with a sleep quality in the 40s to 60s to apnea indices that are substantially lower in the normal range with sleep qualities that are in like the 50s to 70s. So really exciting case of like this idea that sleep apnea does not equal CPAP. Sleep apnea equals some kind of therapeutic intervention. And there's so many different tools out there that we can use, but many times we don't know what's working and what's not working. And this is a really cool example of somebody in whom not only did their overall quality of sleep, not only did their apnea indices get better, but their quality of sleep also jumped up substantially too. Thank you for watching. Stay posted. We'll be sharing another successful sleep story with you hopefully in the next 2 weeks. My name is Sahil Chopra. I'm one of the sleep physicians here, co-founders of Empower Sleep. Hope you guys sleep well. Take care. Bye-bye.